Good day, ma'am. I am Carl Japiti Sabanero from BSN1B. So for today's video, I'm going to show you my return demonstration on vital signs, the 4 procedures, which is first the pulse, the temperature, the respiration, and lastly, the blood pressure. Okay, so let's go. For the assessment, assess client's skin if warm to touch and assess for most appropriate site to check the temperature. For the planning, wash hands and gather the equipment needed. For the implementation, check the client's identification and introduce yourself and explain procedure to the client. And close doors and or use a screen. May I ask to know your name, sir? Okay, Roberto, Sir Roberto. Ilang taon na po sila? So, today, sir, magpalang po temperature sa pinagi sa accelerator. Okay, sir. Look, sir. Is it okay lang ba, sir? Okay. Sir, ha? Then take the thermometer and wipe it with cotton swab from bulb towards the handle. Press the button that will erase the digital numeric display and assist the client to a supine or sitting position. Move clothing away from shoulder and arm. Be sure the client's axilla is dry. If it is moist, pat it dry gently before placing the thermometer. Place the bulb of thermometer in hollow of axilla at anterior horizontally. Hold the thermometer in place until you hear the beep sound. Then, explain the result and instruct the patient if he or she has a fever or hypothermia. Then, dispose the soiled materials properly and wash your hands. And lastly, return all the equipment to its proper place. Okay, sir. Thank you. For the evaluation, evaluate the temperature taken. And for the documentation, record the temperature taken and affix signature on the chart. Let's proceed to taking oral temperature. For the assessment, assist the client's skin if warm to touch and also assist the client mouth for oral lesions and sores. And for the planning, wash hands, gather the equipment needed. Good day again, sir. I'm Carl Japiti Sabanero, your nurse again for today. So, karon sir, bahala po kung temperature, sir, dry sa imong oral, which is sa imong product. Okay lang ba, sir? Okay, thank you. Sir,
Kick.
thank you, sir. Bawal to, sir. For the evaluation, evaluate the temperature taken, and for the documentation, record the temperature and affix signature on the chart, and report an abnormal reading to the senior staff. Let's proceed for tympanic temperature. For the assessment, assist the client's skin if warm to touch, and assist for most appropriate side to check the temperature, either right or left ear. So for the planning, wash hands and gather the equipment needed.
Okay lang ba sir sa imo? So, asa mo ka mas prefer sa left or sa right na dalawang ka? Okay, sa left. Okay sir ha? Yes sir. Okay na siya sir. Okay. So, siya sir. Thank you guys for cooperation.
For the evaluation, evaluate the temperature taken and also the documentation, record the temperature and affix signature on the chart. And lastly, report an abnormal reading to the senior staff. So for the rectal temperature, for the assessment, assist the client's skin if warm to touch, and assist for most appropriate site to check temperature, and assist for any presence of lesions, sores, and in the anal region. For the planning, wash hands and gather the equipment needed. For the evaluation, evaluate the temperature taken and the documentation. Record the temperature and affix signature on the chart and report an abnormal reading to the senior staff. So let's go for the pulse rate. For the assessment, assess the client's condition and check nature of pulse. For the planning, wash hands and assemble the equipment.
For today, I'm cardiac Pero, so, karon sir, magpako pulse rate mo. If okay lang ba sir? Apa naman sir ha? Sir, thank you guys sa cooperation. Thank you very much.
For the evaluation, evaluate nature of pulse, and for the documentation, record result of rhythm and force in patient's chart. For the blood pressure taking, assess the client's physical condition
Sir Robert,
and assess for factors that affect blood pressure. Determine the client's baseline blood pressure.
okay lang ba
And for the
magpako?
planning, wash your hands and gather the equipment that you need.
Sabala ko lang sir ha.
Let's kick.
Yes, sir. So, mga to siya, sir. Thank you sa cooperation. Again. Thank you.
For the evaluation, evaluate the nature of the blood pressure and evaluate the client's condition. And the documentation, record the results taken.